Hi everyone, thanks very much for having me CIV today, and thank you for inviting Monash Council to speak. As Steph said, I'm Emily Halliburton and I'm the Health Promotion Officer with Monash Council. This year I've had responsibility for developing and now implementing the Health and Wellbeing Partnership Plan, which is Monash Council's Municipal Public Health and Wellbeing Plan. To provide context, every 4 years, local governments develop a 4-year municipal public health and wellbeing plan in accordance with the Public Health and Wellbeing Act. And each year, an action plan is developed to identify Year 1, Year 2, Year 3 and Year 4 actions that sit under that overarching municipal public health and wellbeing plan. The Health and Wellbeing Partnership Plan was formally adopted by Monash Council in October 2013. And today I've been invited to present on the partnership focus of the Health and Wellbeing Partnership Plan, the integration of health and wellbeing across Council and with our external partners, and the use of community indicators in the development of this plan. So due to an emphasis on process and approaches of the plan, unfortunately I won't have time to go into great detail each page of the plan or discuss the health priorities that we've decided on in great detail. That would be a whole other presentation, but instead I invite you to visit our plan on our website, and I'll also provide that website link at the end of the presentation, and there are a few hard copies at the back if anyone's interested. This slide shows one of the beginning pages of the Health and Wellbeing Partnership Plan, which is a foreword by our now former Mayor, Councillor Michaela Drieberg. So that's Michaela there. Unique to the development of this plan was that it was overseen by a mayor who is actually a health promotion consultant by trade. So we were very lucky to have Councillor Drieberg's expertise and wisdom, and the plan was also a key policy platform for Councillor Drieberg. In the Mayor's foreword and in the first section of the plan, we state that councils are the closest government to the community and are therefore in a unique position to continuously examine and respond to the health and wellbeing needs of their community. We call out that Monash Council plays an influential role in leading the way to fostering healthy environments where residents feel empowered to strive for positive health and wellbeing in all aspects of their lives. We state that in seeking to reach our health priorities and big visions, Council does not work alone. We were clear from the very beginning that this plan would make explicit the health efforts of all in the community in strengthening and maximising the wellbeing of our community. So hence the title, and an emphasis on partnerships is very much a critical focus of this plan. Our plan begins with a partnership statement, and this statement was developed by our plan steering committee, which was made up of obviously council representatives, community residents, Department of Health, Inner East Primary Care Partnership, Monash Link Community Health Service and Women's Health East. The partnership statement states that partner agencies are committed to working together with council in order to support the Monash community to achieve its optimal health and wellbeing. The statement refers to planning and taking action together and drawing on expertise, diverse skills and resources within these partnerships in order to progress the health of the community. So this partnership statement really sets the context for the plan and the delivery of its health priorities and actions over the next 4 years. The essence of the plan is that health really is everyone's business and that we're all working together for greater health outcomes. This page of the plan explains our integration and partnership approach and identifies the diverse range of council departments, council plans and strategies, and external partner plans and strategies that all have identified health and wellbeing activities that feed into the plan. We state by capturing these activities through the one document, we are reducing the duplication of work across council. We are drawing on the expertise of specific council departments and external partners. We are supported by evidence-based research and we are streamlining council reporting. We're also increasing the efficiency in addressing community health and wellbeing needs and maximising greater health and wellbeing outcomes for the community. And you realise once you start this process, there's so much work occurring already within council and with our external partners. So we really wanted to streamline that all and bring it together in the one piece. On this page, we provide information on our partners where readers of the plan can hover over the pink information icons that you can see and also link through to the website so readers can visit the partner websites for more information. And I'm sorry, because it's set in the Prezi, I can't link you through to the website, but when you view that on our website, you'll be able to use its interactive elements. This part of the page provides the policy framework, plans and community input that fed into the development of the implementation of the Health and Wellbeing Partnership Plan. Once again, the reader can hover for more information on those icons or go through to the website links. In the development of the Health and Wellbeing Partnership Plan, we undertook a comprehensive research and community consultation process. Through this process, we consulted with our community residents through a 2012 survey, which we had over 700 responses for, which is a great result. And this survey identified key health and wellbeing issues in the community. And throughout the stages of the development of the plan, we had 4 community residents who were critical in providing us with strong community voice and priority health issues. And they also provided us expertise and opinions and feedback that we had not encountered and was critical, obviously, to the development of the plan. We also consulted with council reference and advisory groups, including our groups such as the Multicultural, Disability, Positive Ageing, Women's Leadership and Environmental groups to ensure that we were capturing the diverse range of experiences and priorities. We consulted heavily with council departments through frequent meetings with department managers, coordinators and teams. And we met with our external partners regularly through our steering committee meetings and individual meetings to ensure we were capturing all integrated information effectively. And our external partners were deeply committed to the process and extremely involved and supportive. Prior to the plan's development, we undertook a 6-month research project to examine the current health status of the Monash community. This research drew on community indicators and health and wellbeing data, and this research was developed into a community profile titled the Health and Wellbeing Fact Sheets, which is now an appendix document to our health and wellbeing plan. So when you visit our website, that fact sheet information is there as well. And this community indicator research has now been integrated throughout the Health and Wellbeing Partnership Plan, and the following slides show ways in which community indicators have been used throughout. So in this page of the plan, which is called Our Community, we provide selected demographic information about Monash relating to age profile, country of birth, and health issues that are impacting the community, such as racism and violence against women. In section 2 of the plan, we have dedicated pages to each of our 9 health priorities where we use community indicators data to support the evidence and impact behind each priority. So this example is our priority of resilience to harm from gambling, where we've got the evidence of gambling and electronic gaming machines in Monash. And then we have the health harms caused by the impact of electronic gaming machines. We learned from previous municipal public health and wellbeing plans that to have greater efficacy in a partnership approach to community health, a streamlined high-level strategic framework must be established to underpin the implementation of the plan. So this slide shows our strategic framework behind our Health and Wellbeing Partnership Plan. And here you can see the health priorities that we've determined based on our consultations and evidence-based research. And we've set them under 3 pillars there. And as you can see, we have physical activity, healthy eating, preventing harm from tobacco and alcohol, positive mental health, resilience to harm from gambling, social inclusion and fostering diversity, And then we have preventing violence against women, community safety, and addressing race-based discrimination, which became prominent in our consultations that that's a key issue for our community. The framework also takes the reader through the guiding principles behind the framework. So, and once again, readers of the framework can just hover their mouse on those icons just to find out more information about why we've chosen those principles. The framework says who it exists for. Once again, the health priorities. And who it exists for in terms of all people who live, work and learn and play in Monash. And where the Health and Wellbeing Partnership Plan will take effect, which is all aspects of Monash community life, how we will achieve our ambitions and our strategic approaches. In section 2 of the plan, which details our health priorities and the high-level actions we will take over the next 4 years, we support our health priorities with Monash community indicator data, which provides information on, once again, the evidence and impact of each health priority. So this is another example for our preventing harm from tobacco and alcohol, where once again you can see the evidence and then the impact. And then we follow that by the high-level implementation actions that will occur at a local, state and regional level over the next 4 years. And we also detail each council plan under internal and external partner plans that align with the health priorities that we've set and have obviously actions associated with those. We strive for excellence in developing a plan that is accessible to all in the community, that reflects the needs of the community, that calls out critical health priorities and visionary ambitions, and is also innovative in its approach. In each stage of the plan, as I've said, we consulted with community, council and with external partners to keep asking the questions, is this resonating? Where are the gaps? What are we missing? And what could be improved? And we were really clear that we wanted to present the information in a contemporary, clean, interactive and exciting way. As previous slides have shown, we've incorporated interactive elements to the plan through information icons and website links to provide greater context and understanding. Section 3 of the plan, which is our Year 1 action plan, was a great opportunity to present information in a new and dynamic way. In the developing stages of the Year 1 action plan, I began with pulling together all the health and wellbeing activities across council plans and external partner plans that fall under each of our health priorities. And this became a 64-page spreadsheet. While this was a great practice in auditing the amazing amount of health and wellbeing related activities that are occurring across council and in the region, it would be a long and impossible read. Therefore, we came up with the solution to present the information in a smart, interactive and visually appealing way. So part A of our Year 1 action plan emphasises the integration and highlights that supporting the health and wellbeing of the Monash community is a shared responsibility of council, its partners and the community. So under each health priority, we've listed the relevant council plans and external partner plans that have actions directly related to the health priority we've set over the next year. Readers can click on each plan and be taken to the website to view the individual plans. And this is a really exciting way of illustrating all the council departments and external partners that have plans and strategies dedicated to the different health priorities. It highlights to community residents the depth of work being undertaken which seeks to build healthy community environments. Part B of our Year 1 action plan captures a number of new innovative initiatives that have been developed for the implementation in Year 1 that were not included in existing plans. These new initiatives and innovation came out of the comprehensive community consultation process and community health data research. So we recognise the gaps and we've put in place some new priorities over the next year. The evaluation of the Health and Wellbeing Partnership Plan's health priorities and activities will be conducted through an annual report on a yearly basis in consultation with council departments and external partners. Through this process, we will be accessing available impact measures from sources including program evaluations, data from partner organisations, census information, community surveys and community indicator data. So through many manifestations of the plan, and there were many, there was about 40 different versions of our draft, and comprehensive consultation throughout all stages of the plan, we believe we now have a policy document that effectively communicates Monash Council's public health principles, priorities, projects and community partnerships that all interconnect to improve the health and wellbeing of the community. And we believe we've come up with a plan that is contemporary and innovative and presents integration and partnership in a streamlined way, whilst effectively providing a depth of evidence base through community indicators research. Please contact me for any further information, and I really would encourage you to visit our website to go through the plan, interactive electronic version of the plan. Thank you very much.